This is the curve of COVID-19 infections in Kenya, just about 1 month since the first case was confirmed. It is a slow but steady rise. In the first week of April, the curve took its highest increase after reporting 22 and 29 cases on the first and second days. According to COVID-19 curves, as plotted by data analyst Juliet Atela, although Kenya has a steeper curve than neighboring Uganda and Rwanda, the 246 confirmed cases in Kenya pale in comparison to countries like South Africa, Egypt and Algeria, which are grappling with more than 2,000 cases each. While this may appear good news for Kenyans, experts say it is too early to celebrate.
Everybody agrees that we haven't tested nearly enough. Today, even the president said we have tested 10,000. We probably need to test many more people in order for us to have a clearer image of what's happening across the country.
Our measures are slowing the rate the disease would be spreading, but we must be honest and say that there are still infections underway in nearly half of our counties.
The numbers that we are seeing now at the national level and even at the county level may not necessarily give us the true picture of how deep this virus has gone in our community.
With the focus heavy on 4 risky counties now identified as infected areas, there is fear that the limited testing could be detrimental to a desire to contain the spread, especially in Kilifi and Mombasa counties.
We have tested in Mombasa 486. 486 is a number, in my opinion, that should be tested in a day. Out of 486, we have 37 positive. That for me is a worrying trend. One, a bigger number of it is local transmission. Local transmission is the trend that worries me a lot, and that is why there's an urgent need for us to do mass testing.
The countries that have recorded more cases in Africa have also tested more people than Kenya. Kenya has tested just under 11,000 people, Ghana more than 50,000 people. South Africa has tested more than 95,000, Uganda nearly 9,000 people, while Rwanda has tested just over 6,000. Botswana has tested over 3,400 people. Important to note, however, out of the 10,700 tested people in Kenya, 2.3% have turned positive. This compares to South Africa, whose more than 95,000 tests have returned 2.7% positive cases. But there is no way to predict the future curve for a country, scientists saying even testing cannot predict the outcome, the best way through it being the response taken to contain and mitigate the scourge. In Kilifi County, Governor Amason Kingi will rely on the Kemri branch in Kilifi to conduct mass testing as announced by the national government.
As a county government, we are rolling out our mass testing as from Monday next week. And we have planned it in such a way that we will start with our health workers.
What we are trying to do, and I think we must achieve, is to be able to do mass testing on a daily basis, not less than 1,000.
Even if Mombasa is going to do 1,000 tests per day, and by all means they need to do more than that, it should be coordinated by one mechanism so that there's a way in which those results are not useful in their own right. Those results are useful in informing the next course of action that is being coordinated nationally at the moment.
While efforts are being made to boost the testing capacity, it may never be enough to test every citizen. As such, the Ministry of Health has been identifying risky areas that require targeted mass testing.
The Ministry of Health has received more testing reagents that will allow us to upscale our testing capacity, starting with targeted areas and eventually to the wider Kenyan population.
And we were not going to be able to start our mass testing capability, but with these tubes now, we are able to fast track.
Countries around the world that have been able to flatten their curve of infection have relied on mass testing to ensure they can, as quickly as possible, identify and isolate the infected, trace their contacts, and put them in quarantine.
If we are not able to do that amount of testing, then we will be shooting in the dark. We will be like an army that is going to the battlefront blindfolded, not knowing where the enemy is coming from, not knowing how many they are, not knowing what kind of weapons your enemies have. and you're being thrown to the front line.
In the US, for instance, a country that leads the global spread by nearly 700,000 cases, over 3.4 million persons have been tested, representing a 19.8% COVID-19 prevalence among those tested. The US curve has been rising at an alarming rate. Kenya hopes not to get to that point. While more cases in Kenya will keep the curve going, the hope is that it can do so at a decreasing rate, reach a plateau, and perhaps a stop as gains against COVID-19 yield the much-anticipated results. Sam Gituku, TV, Nairobi.